we are going to see the posterior triangle of neck in this video. So this is the view after removing the skin over the face and neck region. This muscle over here is the platysma. On removing the platysma, we will be able to see the borders of the posterior triangle very clearly. This is the view after removing the platysma and investing layer of deep cervical fascia. So basically the roof of the posterior triangle is formed by the skin, superficial fascia, platysma and investing layer of deep cervical fascia. Now we will see about the boundaries of the posterior triangle. In front, it is bounded by the posterior border of the sternocleidomastoid muscle. Behind, it is formed by the anterior border of the trapezius. This muscle will be the trapezius. Now, base will be formed by the middle 1/3 of the clavicle. The apex of the posterior triangle, that is this region, it is formed by the superior nuchal line of the occipital bone where the sternocleidomastoid and trapezius muscles meet. So the platysma forms the lower and anterior part of the roof, and beneath the platysma the roof is crossed by the supraclavicular nerves and external jugular vein. The investing deep fascia at the roof is pierced by the cutaneous branches of the cervical plexus and by the external jugular vein. When we look at the posterior triangle, we can see mainly two subdivisions. The triangle is divided by the inferior belly of omohyoid, which is lying over this region. About 2.5 cm above the clavicle, the inferior belly of omohyoid crosses the posterior triangle obliquely upward and forward and divides it into upper large occipital triangle and the lower small supraclavicular triangle over this region. The omohyoid is part of infrahyoid muscles and consists of inferior and superior bellies. This is the inferior belly and this one will be the superior belly. The inferior belly arises from the suprascapular notch and the adjoining transverse scapular ligament extends upward and forward beneath the anterior border of the trapezius around this region to join with the intermediate tendon under cover of the sternocleidomastoid muscle. That's over this region, deep to this region. Through the latter, it is attached to the body of the hyoid bone by means of the superior belly. Let's look at the triangle one by one. First, the occipital triangle, that is over this large region. The occipital triangle is bounded in front by the posterior border of the sternocleidomastoid muscle, behind by the anterior border of trapezius, then below by the inferior belly of omohyoid. The floor of the occipital triangle is formed from above downwards by a part of semispinalis capitis over the uppermost region, then splenius capitis, then levator scapulae over this region, then we have the scalenus posterior, this muscle, and scalenus medius. The fibers of semispinalis capitis are vertically disposed. Rest of the muscles slope downward and backwards. The muscular floor is carpeted by the prevertebral layer of the deep cervical fascia. Let's look at the contents of the occipital triangle. For better understanding, first we will look at the 4 cutaneous branches of the cervical plexus. These are the cutaneous branches. These branches, they pierce the facial carpet that covers the floor of the posterior triangle, that is the prevertebral layer. They pierce the prevertebral layer, then they pass for a short distance through the posterior triangle, then they radiate from near the middle of the posterior border of the sternomastoid and pierce the investing layer of deep cervical fascia for their final distribution. The first one of them, the lesser occipital nerve, it runs upward along the posterior border of the sternomastoid muscle after winding around the accessory nerve. This is the accessory nerve in this diagram. So the lesser occipital nerve winds around the accessory nerve. The great auricular nerve, that is this nerve, it passes upward and forward along the upper part of external jugular vein and supplies over this region. The third one is the transverse cervical nerve. They are these nerves. This transverse cervical nerve, they pass forward across the sternomastoid and divides into descending and ascending branches, which accompany the anterior border of that muscle. And the trunk of the supraclavicular nerve, it descends and divides into its three terminal branches. These are the three terminal branches. Now we look at the next content, that is the spinal part of the accessory nerve, or we can call it as external branch of the 11th cranial nerve. Okay, it appears in the posterior triangle deep to the midpoint of sternomastoid, posterior border of the sternomastoid, where the nerve is hooked superficially upward by the lesser occipital nerve that we have seen already, and it is surrounded by a group of superficial cervical lymph nodes. The nerve passes downward and backward between the facial roof and the facial floor of the triangle, resting on levator scapulae. In this diagram, this is the accessory nerve. The sternocleidomastoid muscle is cut and reflected over this region so that we get a clear picture of this diagram. Now this is the accessory nerve. This accessory nerve lies over this muscle, that is the levator scapulae. The accessory nerve disappears under cover of the anterior border of the trapezius about 5 cm above the clavicle. This is that point. The spinal accessory nerve is usually the highest structure and genuine content of the posterior triangle. It provides motor supply to the sternomastoid and the trapezius muscles. It is practically plastered to the investing layer of deep fascia at the roof of the occipital triangle. Therefore, a superficial incision to open a subcutaneous abscess at the middle of the posterior border of the sternomastoid should be made carefully to avoid injury of the nerve. The accessory nerve divides the posterior triangle into a carefree triangle above and a careful triangle below, because most of the important structures lie below the nerve. Now we look at the next content, that is the third and fourth cervical nerves. They convey, in this diagram, these are the third and fourth cervical nerves, anterior rami of the third and fourth cervical nerves. They convey muscular branches from the cervical plexus. They pass a little below and parallel with the accessory nerve under cover of the prevertebral fascia. They provide branches to the levator scapulae and trapezius. Those for the trapezius pass deep to that muscle and form a plexus with the accessory nerve. So far we have seen three groups of nerves. The first one was the cutaneous branches of the cervical plexus. They came from deep to the prevertebral layer. They pass through the posterior triangle and they pierce the roof of the posterior triangle. Then they reach their area of supply. The next nerve was the spinal part of the accessory nerve, and this nerve lies within the posterior triangle between the roof and the floor, and it is plastered on the deep surface of the roof, that is the investing layer of deep cervical fascia. Then the third and fourth cervical nerves, they lie deep to the floor, that is the prevertebral layer of deep cervical fascia, and they supply the corresponding muscles. So this is the planes by which the contents of the posterior triangle are arranged. Next content is the dorsal scapular nerve, which is not clearly shown in this diagram. It conveys fibers from the C5 root of the brachial plexus. This is the brachial plexus. So it conveys fibers from the C5 root. It pierces the scalenus medius muscle, that is this muscle, and it passes backward and downward under cover of the prevertebral fascia and disappears beneath the levator scapulae to supply the rhomboids muscles. Next content is the upper trunk of the brachial plexus. This was the region occupied by the inferior belly of omohyoid. It was cut and reflected over this region. The upper trunk of the brachial plexus, formed by the C5 and C6 roots, they peeps in the occipital triangle between the scalenus medius and the inferior belly of the omohyoid. The upper trunk is vulnerable to external injury and is known as the Erb's point. Next content is an arterial content, that is the superficial cervical artery. It is a branch of the thyrocervical trunk which is derived from the first part of the subclavian artery. The artery passes upward and laterally in front of the brachial plexus over this region. This is the brachial plexus, and the artery passes in front of them and across the floor of the posterior triangle over this region and disappears deep to the trapezius muscle. It anastomoses with the superficial descending branch of the occipital artery. Next content is the occipital artery. It is an occasional content. It is a branch of the external carotid artery. It appears at the apex of the triangle and rests on the semispinalis capitals. The artery then ascends tortuously over the back of the scalp, accompanied by the greater occipital nerve. That was in general about the occipital triangle. Now we will move on to the supraclavicular triangle. It is also known as the subclavian triangle since it contains the subclavian vessels. It presents the following boundaries. Above, it is bounded by the inferior belly of omohyoid. Below, middle one-third of clavicle. In front, lower border of the posterior border of sternomastoid, which was removed in this diagram. The roof of the supraclavicular triangle, it is formed from outside inward by the same structures that we have seen earlier, that is skin, superficial fascia, platysma, and investing layer of the deep cervical fascia. Beneath the platysma, the investing layer is pierced by the three diverging branches of the supraclavicular nerves. Here they are. And by the external jugular vein. The investing layer splits above the clavicle to enclose the supraclavicular space. The floor of the supraclavicular triangle, it is formed by the outer border of the first rib, that is not shown on this diagram, the scalenus medius near its insertion, then the first digitation of serratus anterior. Usually the scalenus anterior, that is this muscle, it does not form the floor because it is overlapped by the sternomastoid. All the above structures of the floor are covered by the prevertebral fascia. Now we will look at the contents of the supraclavicular triangle. The first one is the third part of the subclavian artery, which can be seen over this region. This is the third part of the subclavian artery. It extends downward and laterally from the lateral border of the scalenus anterior, that is over this region, to the outer border of the first rib, where it enters the apex of the axilla and is continued as the axillary artery. The scalenus anterior muscle, that is this muscle, it divides the subclavian artery into three parts. The first part up to the medial border of the muscle, the second part behind the muscle, and the third part from the lateral border of the muscle to the outer border of the first rib. The branches from the first part are the vertebral artery, internal thoracic artery, the thyrocervical trunk on both sides, and the costocervical trunk on the left side. The second part of the artery gives origin to the costocervical trunk on the right side only. The branch of the third part is the dorsal scapular artery, which is shown on over this region. The next component will be the subclavian vein, which is shown over this region. This is the subclavian vein. It usually lies behind the clavicle and does not appear in this triangle. It begins as a continuation of the axillary vein at the outer border of the first rib and ends at the medial border of the scalenus anterior by joining with the internal jugular vein. This is the internal jugular vein, and it joins with the internal jugular vein to form the corresponding brachiocephalic vein. The vein is separated from its artery by the scalenus anterior muscle and lodges in a groove on the upper surface of the first rib antero-inferior to the artery. The next content is the terminal part of the external jugular vein, which is not shown in this diagram. It pierces the investing layer of deep fascia, omohyoid fascia, and opens into the subclavian vein. In the space between the investing and omohyoid fasciae, the external jugular vein receives transverse cervical, suprascapular, and anterior jugular veins. These veins sometimes form a plexus in front of the subclavian artery. The next content of the supraclavicular triangle is the trunks of the brachial plexus. That is, these structures. These are the trunks of the brachial plexus, which is visible in the supraclavicular triangle. The brachial plexus presents three trunks, upper, middle, and lower, which emerge downward and laterally from the interval between the scalenus anterior muscle and scalenus medius muscle to the outer border of the first rib and lie beneath the prevertebral fascia. Upper and middle trunks, they lie above and lateral to the third part of the subclavian artery, whereas the lower trunk lies behind the artery and lodges in a groove on the upper surface of first rib along with the artery. We are not going to detail about the brachial plexus. So the supraclavicular triangle consists of the trunks of the brachial plexus and the following branches from the supraclavicular part of the brachial plexus. The one of them is dorsal scapular nerve. It arises from the C5 root. Second one, long thoracic nerve. It arises from the C5, C6 and C7 roots. Next one, nerve to the subclavius. It arises from the upper trunk carrying fibers from C5 and C6. The next one, suprascapular nerve. It is another branch of the upper trunk and conveys the fibers from the C5 and C6. This is the phrenic nerve. Although the phrenic nerve is not within the geometrical limit of the posterior triangle, it would be an omission if it is not seen after retracting the sternomastoid medially. The phrenic nerve is formed by the ventral rami of C3, C4 and C5 and passes vertically downward in front of the scalenus anterior muscle in naked contact with the muscle and under cover of the prevertebral fascia that forms the floor of the posterior triangle. Owing to the obliquity of the muscle, the nerve crosses the scalenus anterior from the lateral to medial side in this fashion, and it is overlapped by the sternomastoid and internal jugular veins. It is crossed by the omohyoid muscle, that is this muscle, then the superficial cervical or transverse cervical arteries, then suprascapular arteries, and additionally by the thoracic duct on the left side. The phrenic nerve supplies the diaphragm. The next component are the arterial components of the supraclavicular triangle. They are the superficial cervical, suprascapular and dorsal scapular arteries. The superficial cervical and the suprascapular arteries are the branches of the thyrocervical trunk which is lying over this region. It arises from the first part of the subclavian artery. The dorsal scapular artery is a branch of the third part of the subclavian artery, as we can see from this diagram. The superficial cervical artery, that is this artery, it passes laterally and upward across the floor of the posterior triangle in front of the brachial plexus and levator scapulae and ascends deep to the anterior part of the trapezius. The suprascapular artery, it passes laterally and downward in front of the subclavian artery and brachial plexus, behind and parallel to the clavicle, and reaches the upper border of scapula deep to the inferior belly of omohyoid. It enters the supraspinous fossa above the transverse scapular ligament and joins with the other arteries to form the scapular anastomosis. The dorsal scapular artery, it passes laterally in front of the scalenus medius, that is this muscle, and you have to note one important point, that is the artery then passes through the brachial plexus. This was the brachial plexus. The dorsal scapular artery passes through the brachial plexus and then reaches the superior angle of the scapula deep to the levator scapulae, where it accompanies the dorsal scapular nerve. One important point to note is, in about 1/3 of the cases, the superficial cervical, that is this artery, and the dorsal scapular artery, they arise as a common stem from the thyrocervical trunk and is known as the transverse cervical artery. The next content of the supraclavicular triangle will be the posterior-inferior group of deep cervical lymph nodes, otherwise known as the supraclavicular nodes. These are situated in relation to the inferior belly of omohyoid between the facial roof of the triangle and facial floor, and superficial to the brachial plexus and subclavian vessels. So this was in general about the contents, boundaries and other features of the posterior triangle of the neck. Thank you for your patient listening.